Hi everyone, and welcome to our lecture on case control studies. So we'll just hop right in. Case control studies compares exposure histories in people with a disease, so that would be the cases, and people without the disease, so those would be the controls. So you have these two groups of people. One group has a disease. You're going to kind of look back in time to see if they have, like, what exposures they had. And then you have the controls who don't have the disease. You're going to look back in time to see what exposures they may or may not have had. And then you're going to compare these two to see if there's more likelihood that an association would be exposed with having the disease, or perhaps an association would be determined between those who were exposed to something and who do not have the disease. So this is a type of comparison study. This is one of those studies that has a comparison group, and this is the type of study that you can use to identify possible risk factors for disease. Now, when we talk about our case definitions, we really want our case definitions to be well defined in terms of PPT, and PPT stands for person, place, and time. So these are extremely well defined. So if I'm studying an outbreak of whooping cough, and I find that I've got some cases at this certain maybe pediatric hospital of whooping cough, and then I've got some other controls of children at the same hospital who don't have whooping cough. So I need to define my case very clearly. So in terms of person, my case would be any person with a confirmed case of whooping cough, defined as 1, an acute cough of any duration with isolation of Bordetella pertussis from a clinical specimen, or 2, a cough lasting 2 or more weeks with paroxysms of coughing, inspiratory whoop, and or post-tussive vomiting in an individual known to have had contact with a laboratory confirmed case of pertussis. That's very, very well defined in terms of person. Place, so for my particular study, it would be residents of River City whose diagnoses were reported to the River City Health Department. So in terms of place, it's all going to be residents of River City. And then I also have to define it well in terms of time. So I am looking at patients who first sought clinical care for a cough between January 1st and March 31st, 2020. So it's all very, very, very well defined. You want to define your case well. You also want to define your control well. And you want your controls to be as similar as possible to your cases, except for disease status. So if you are looking at a factory and you have some people who have a certain disease and some people who don't, you can match those people and see who was exposed perhaps to a certain chemical in the factory and see if that chemical has an association with having the disease or not having the disease. This goes true with, people who work in hospitals or students. Just make sure you are matching your cases and controls. The only difference should be disease status. Once again, this is just, we are looking back at exposure histories, and we have two groups, cases and controls. So there was this doctor back around the time of World War I, and he was kind of the first to notice the association between tobacco and lung cancer. So his interest in this relationship began serendipitously in his 3rd year of medical school when he witnessed the autopsy of a patient with lung cancer. It was rare at the time, and he wouldn't observe another case of it for about 17 years. But when he encountered 8 cases in a period of 6 months in New Orleans, he began to consider lung cancer almost as an epidemic, and he knew there had to be some cause. He figured out what was in common between all the lung cancer patients, and they were men who smoked heavily and had begun smoking during the First World War. Whereas prior to the war, cigarette consumption had been really low. So a case control study would be appropriate in this case because you have people with a certain disease And you're going to compare them to people who don't have that disease, and you're going to see what differences there are in exposure histories. And we're going to find out that those who had the lung cancer were more likely to be exposed to cigarette smoke. Now, there is a reason why we do a case control study in this case instead of an experimental study. And that would be regarding ethics, right? We cannot do an experimental study where we subject people to, okay, you are going to smoke 3 packs of cigarettes for the next 3 years a day, and you are not. And now we're going to compare you over time. We cannot expose people to things that will cause them harm just to find out information. So looking back in time to something that's already happened, to an exposure that has already happened, is our go-to. So we talk about comparing the odds of exposure versus the odds of non-exposure in the 2 different groups. And this is something that's called the odds ratio. Now, if I ever ask you for the key statistical measure for a case control study, it's going to be odds ratio. This is often abbreviated as OR, odds ratio. And this is basically a comparison of probabilities. So a case control study examines the likelihood of participants having had a particular exposure or not having had a particular exposure. So first, in order to get an odds ratio, we have to figure out the odds. So we look at our cases and we see what are the odds that they were exposed. And then we figure it out like any odds statistical mathematical problem by saying the probability divided by 1 minus the probability. The likelihood of an event happening over the likelihood of an event not happening. We will do that for the cases, we will do that for the controls, and then we will compare the odds of both of them in our odds ratio. So the odds ratio is a comparison between odds. So what we are looking for is the odds of exposure among cases versus the odds of exposure among controls. And to do this, we do a very straightforward kind of mathematical calculation using this 2x2 table. We set it up, cases and controls, exposed and unexposed, and then we can do a study and fill in the numbers. And here's just a quick example of how to do that. So let's say we're going to do a study. Is there an association between exposure to air pollution and asthma in college students in Naperville? So what we're really looking for is, do cases and controls have different exposure histories? So cases are going to be college students in Naperville who have asthma, and controls are going to be college students in Naperville who do not have asthma. And we're going to look back in time to see if they have a different exposure history. So we'll do our case control study where we compare exposure histories between cases and controls. And then, so we can ask questions, we can do a questionnaire, and then we can fill in our 2x2 table with results from our questionnaire. And then after we fill in our table, we can tell what the odds ratio of asthma is among college students in Naperville who were and were not exposed to pollution, and see if perhaps there is an association. So these are our results from our fictional survey questionnaire. And so we surveyed a total of 1,000 college students in Naperville. Of the people who have asthma, there were 100 of them. 50 of them said yes, they were exposed to pollution. And 50 of them said no, we were not exposed to pollution. Those who do not have asthma, there were 900 of them. 200 of them said yes, we were exposed to pollution. 700 of them said no, we were not exposed to pollution. So the have asthma is our case group, and the do not have asthma is our control group. And we are going to compare the odds of them having been exposed to pollution versus not having been exposed to pollution. So remember that we are looking at the odds of exposure. So we're looking at the likelihood of an event happening over the likelihood of an event not happening for each group. we're going to compare odds over odds to get our odds ratio. So we say, what are the odds that a student who has asthma was exposed to air pollution? So we figure out the odds for that group of students who have asthma. And we see, oh, okay, 50 of them have asthma and they were exposed to pollution. 50 of them have asthma and they were not exposed to pollution. So we figure out the odds, and our odds, basically 1-to-1, that a college student in Naperville that has asthma was exposed to pollution. But we're not done. That's just the odds for our cases. Then we have to look at the odds for our controls. What are the odds that a student who does not have asthma was exposed to air pollution? So we figure out our odds. 200 of the controls were exposed to pollution. 700 of the controls say they were not exposed to pollution. Therefore, their odds, the odds that they were exposed, it's 0.29. So now we have these two odds. We have the odds that a college student with asthma was exposed to pollution, and the odds that a college student who does not have asthma was exposed to pollution. What do? Well, we're going to look at the odds ratio. And when we look at the odds ratio, we take this number, the odds that a student with asthma was exposed to pollution, which is 1, and we take this number, the odds that a student who does not have asthma was exposed to pollution, and we compare them, and we get a number for our odds ratio. And our odds ratio in this hypothetical fictional example is 3.4. Great. What do we do with that? Oh, this just tells you everything that I just told you. Okay, what do we do with that 3.4? So why is this useful? So we have to think about how we interpret odds ratio. Okay, so if the odds ratio is equal to 1, that means that the odds of exposure were the same for cases and controls, and you really can't say this exposure is associated with something or not. However, if the odds ratio is greater than 1, then you can see that the cases had greater odds of exposure than the controls, indicating that the exposure was risky. And if the odds ratio is less than 1, we can see that the cases had lesser odds of exposure than the controls did, indicating that exposure was protective. So in this case, we have an odds ratio of 3.4. So we say, is our odds ratio 1? Not in this case. Is our odds ratio greater than 1? Why, yes, it is. So then we can determine that, oh, look, the cases, the students who have asthma, have a higher likelihood of having been exposed to pollution than those who did not have asthma. So this, again, is just something to keep in mind, how to interpret odds ratio, right? If the odds ratio equals 1, then the odds of exposure were the same for cases and controls. If the odds ratio is greater than 1, then cases had greater odds of exposure than controls. If the odds ratio is less than 1, that means that cases had lesser odds of exposure than controls, and this indicates that exposure may have been protective. Interesting. So let's take a look at one more example. This is my little example with pennies. So I had these pennies and I divided them into a case group and a control group. Each group has 11 pennies in them. I noticed, there was this epidemic of fuzzy cotton disease. So that defined my cases. If they have this fuzzy cotton disease, they go into the case group. If they don't have fuzzy cotton disease, they go into the control group. But I also noted that some of the pennies had this white nail polish on them. And I wanted to see, well, do we have an association between the white nail polish and the fuzzy cotton disease? So I count up the number of cases that were exposed to white nail polish, and there were 2 of them. And I count up the number of controls who were exposed to white nail polish, and there were 8 of them. So I am doing a case control study now to figure out what the association is, if any, between white nail polish and fuzzy cotton disease in pennies. So I build my 2x2 table. I have my cases and my controls. I have my exposed and unexposed, and I am going to figure out the key statistical measure. The key statistical measure is odds ratio. So we have 11 cases. So this is a total of 11 cases. We have 11 controls, total of 11 controls. And that gives us a total of 22 pennies. We have our exposure is nail polish. So 2 of our cases have been exposed to white nail polish. So we put our number right in there, and then we do the math. So that leaves us how many who were unexposed in our case group? 9. Now we look at our controls. We have 8 of them who were exposed to the white nail polish. There we put our number, we do our math, and we find out that 3 were unexposed. We can add up our totals just to make sure everyone's accounted for. And then we figure out our odds. So what are the odds that a case has been exposed to white nail polish? Well, we take our numbers. The odds are 2 to 9, or 0.22. Our next step, what are the odds that a control has been exposed to white nail polish? We take our numbers. The odds are 8 to 3, which mathematically equals 2.67. Now we have to figure out the odds ratio. So we set up our odds ratio calculation using our 2 numbers. And we get that our odds ratio is 0.8. Okay, so what do we do with this number? Well, we go back to how to interpret an odds ratio, and we remember that if odds ratio equals 1, the odds of exposure were the same for cases and controls. If odds ratio is greater than 1, cases had greater odds of exposure than controls, indicating that exposure was risky. If the odds ratio is less than 1, then cases had lesser odds of exposure than controls, indicating that exposure was protective. So our odds ratio is 0.08. So we see our odds ratio is less than 1. And this indicates that white nail polish was protective against fuzzy cotton disease in pennies. So can we think of any